So tell me, let's go into the data now because you're more of an engineer. You understand that. What have you been seeing since you've gotten this out in your clinic, other clinics? What is it doing? What types of conditions are you seeing improvement in?
So my objective was to identify our top 10. We have around 80 diseases that we've clarified in our medical database that it has an effect on. So I've taken that data, Casper, and I've taken each disease and I've added 5 stages to that disease. So let's assume that somebody has Lyme. And that was our first, Jeff out in Beloit, Wisconsin, out of his clinic. His wife had chronic Lyme disease. He goes, John, my wife will be the guinea pig. Let's do it. On Lyme disease, she did 6 procedures, and we did it to our frequency that we had proven. So the normal procedure and frequency of the procedure is 2 the first week and 2 the second week. There's a reason for that. Ultraviolet blood irradiation works from day 1 as you get it. It starts peaking around day 3 and goes for 10 days. So what we've identified is that if you front load it to try to flush out the underlying diseases, depending on what it is, if it's HIV/AIDS, it's going to be a different frequency. If it's mononucleosis, it's going to be different. If it's a tumor or blood, skin conditions. So we have identified the best frequency for that particular disease. Now, what we're hoping to do when we get the next device onto the cloud is that every person's different. Every person eats different, lives different environments, breathes different, has different physical activities, is that we're going to fine tune this for each particular patient. Unfortunately, right now we have a generic set of guidelines and we know that works. And so by front loading that, I've noticed that it doesn't have to be male or female. Your hair becomes a lot more fluent and airy. Your eyes become wider. You breathe better. You have more energy. These are all standard, almost 100% from data that we've seen, Casper, is that even if you're not sick and you come in, for the first 3 days, you might not feel it, but the 4th, 5th, or 6th day, you might feel a little energy. Some people, if you're attuned to your body. Mm-hmm. Now, the reason I say that is it's so gradual, and because you look in the mirror every morning. So if you're gradually changing, you're not going to notice the change. But on my patients that I see once a month, I see a tremendous difference in them, and they notice it. When you tell them, did you see the whites of your eyes? Did you see your hair? And the women actually let me know about it. I'm feeling good. I look good. And it also gives a very positive attitude to people. I have patients in their 60s and 70s that come in, and I hate to say this, but they would rather be 6 feet under because they feel so bad. They don't want to wake up in the morning. My gosh, after the 3rd procedure, these people are coming in and looking forward to living life again. They're looking forward. They're actually getting up and cleaning their house. They're getting up and finding things that for decades they've been looking for this box in the closet and haven't been able to find it. So what I see that is generally on a person's quality of life, you want energy. You want to be able to think clearly. You want to be able to see as good as you can. You want to be able to discuss things with your kids or your parents or your better half. And you want to be able to think clearly and in order to do that. And what I've seen from ultraviolet blood irradiation, it's actually doing that.
Yeah, no, we've definitely noted it also. I mean, regular UVB therapy was pretty effective.
Yes.
This isn't to knock it or say that it wasn't working and needed something to work.
No, I don't.
You've just enhanced it. You've really taking it to the 21st century and beyond, you could say.
Thank you. And that's what I was trying to do with this. Yeah. I believe I have. Thank you, Casper.